So I'd like us to proceed from where we had stopped yesterday. And now today I want us to talk about inclusivity or AI for inclusivity or AI tools for inclusive learning and special needs. So today's discussion is on AI for inclusive learning and special needs. What is inclusive learning? And then what is this special needs learning? So AI has the ability to empower every learner, regardless of their ability, the backgrounds, or the circumstances that these learners have. Therefore, as we speak about this, then we have to understand what are the special needs and what are some of the AI tools and interventions that are being applied today in order to provide solutions. So what I've displayed for you is the visual impairments, that is a special need. Hearing impairment is a special need. Dyslexia and reading difficulties is a special need. Autism spectrum is a special need. Then we have physical stroke mental motor disability is also a special need. And then we have intellectual disabilities. Um, in order to sort out this, we have screen readers that are utilizing the AI capabilities and functionalities, such as the NVDA, the JAWS. We have AI image description using what are called Microsoft's Seeing AI. We have Braille translation AI, and then we have the audio learning companion. So all these are very powerful AI tools that are used to help learners or students with visual impairments. Then we have, when it comes to hearing impairments, we have the real-time AI captioning, such as the transcriptions or transcribes that you normally get in YouTube, uh, or any video related. Then you have the sign language AI avatars. We have the visual alerts and the AI subtitle videos. So we also have the speech to text classroom tools, which are also used to help uh, learners or people with hearing impairment issues. Then we have those who have dyslexias or the reading difficulties. This is where we have the AI text to speech. We have highlighters. We have the word prediction engines. We have the adaptive font and spacing AIs. And we also have AI powered phonics coaches, which are used to sort such kind of issues. For students who have problems, or for those people who have problems with autism spectrum, we have special skills learning AI, which are called the Milo robot. The Milo robot, emotion recognition feedback tools, and then we have predictable AI tutors for routine. Then we have the augmentative communication AIs, that is the AAC. So all these are tools that are used to help students with the autism. So like if you open, for instance, this section here, and then you say the Milo robots. So the Milo robots work like this.
We really had to think through like what are we doing and what are we trying to deliver. So we're trying to teach social and emotional skills as well as some behavioral regulation. So you want something that's humanoid that can move somewhat and look somewhat like a person so you can teach those skills. We need a face that moves. You need something that can smile and frown and be surprised and show simple emotions and complex emotions. Then the speech.
I'm Milo and I want to ask you to help us improve the lives of children with autism.
The speech is consistent, and then we figured out early on that slowing it down just a little bit was really helpful. And then for kids who need visual reinforcement, we used the little screen on his chest, and we developed about 1,500 little flashcards, icons, to reinforce the concepts that we were teaching. Then once we realized we'd pair this whole thing with a tablet, we figured out we could do some video modeling as another form of reinforcement learning. And then he's got a little camera right above the screen on his chest. One of the ways we use it is in the emotional skills training. When we're teaching someone to express themselves, we'll use the camera, for instance, to mirror. So, again, if we're teaching a smile, we'll describe it. Milo will show it. We'll show pictures of people smiling. We'll show videos of people smiling. And now it's time for you to practice. And so when it's time for you to practice, we want you to be able to see yourself. So Milo's got a camera and a screen. I mean, we literally use it as a mirror in that instance. And then it was really important to create what I think of as a stable platform. A lot of the robots out there, including things I've built, are really cool and they're great robots, but they're not robots that are meant to be around kids. We have a robot that is durable and safe enough, a total workhorse that can work all day, all school year, and be safe around kids. And then on top of that, something that was easy to use and wasn't intimidating to use, making the user interface as simple and familiar as process, like any other learning management system or any other portal they're using for any of their other existing things that they have to do. With respect to data and data collection generally, the data collection is done passively basically as the lesson happens. Just by doing the lesson, you're generating the data and collecting the data. So there's no extra paperwork. The last consideration, and what ended up being one of the most difficult things that required the majority of the technological innovation we did, was bring the cost down. Bring the cost down to something a public school can afford.
Monster Math presents Addition Below 10. Okay, class, let's begin.
So that is the story about Milo. They are very special tools that can help make the autism child be able to interact with with the learners or with the persons, so that they don't feel like they are alone. So that is how uh, some of those things look like. So there are so many that I've just mentioned there. What you need to do is to be able to spend your time now to be able to look at several of them. Um, we have the physical or the motor disabilities. So when we have this, then we talk about the eye tracking AI input devices. We have those ones which are able to work on that. Then we have the voice controlled learning environments. We have the switch access AI interfaces. And then we have what is called the AI powered uh, prosthetics and mobility. So those are the major tools that are used in that to be able to help those with the physical disabilities. Then we have those ones which can support intellectual disabilities, children or humans. This includes the simplified AI content generators. We have the microstep task AI coaches, and then we have the visual schedule and routine AI, and then we also have the progress monitoring dashboards. And all these are very, very powerful tools that are used to help manage and support people with intellectual disability issues. Now, what are the universal design for learning and the AI tools that are being used? So, when you talking about universal design for learning, then talk about multiple means of the representation, talking about the multiple means of actions and expressions. Then we also have the multiple means of engagements. How are these students, how are these people with disability issues being engaged? How are the actions and expressions being taken care of? How are the representation being handled within them? So we have tools like the AI translates text into audios and videos, like the InVideo tools. We saw the other yesterday another one there that we used to create something simple. Uh, we have the content simplified to appropriate reading levels automatic, and then we also have the multiple language AI translations. That is the ability to translate into various languages like the Swahili, the Kikuyus, the English, and so on. Someone was just asking me that, am I able to translate my Luo language into English? Then I said that you can be able to try using any AI chatbots, and indeed it happened. So then we have AI alt text generation for all images. That is an alternate text that is normally within outside an image that completely describes about something, or you can be able also to attach a link to be able to access something. Then we have the multiple means of action expressions, where we're talking about the voice, gestures, typing, or eye tracking, AI that accepts all this. Then we have the AI assisted essay writing scaffolds for diverse writers. And we also have the speech to text for oral learners and submitting uh, the written contents within that. So, for instance, if you are talking about the speech to text for oral learners, then we have AI portfolio tools support for non traditional assessment. So, maybe the speech, if we say that we are looking for like the speech to text for these submitted tools, we have some of the powerful tools that are used in that space, which you can be able to find them within the the digital space here. For example, if you have a tool like the ones that can describe or the ones that can perform other tools like.
Hi everyone, I'm Sharon Smith, and in this video I'm going to show you how to use dictation tools in both Microsoft Word and Google Docs. Typing hands-free, click the button here to speak. Saves you time.
It's called Texticians.
Using voice-to-text technology is super easy. It saves you time and allows you to get your thoughts captured quickly. All you really need is your computer's microphone and a reliable internet connection to use voice typing. For Microsoft users, you do need a subscription to Microsoft 365 and to be on Windows 10 or above. But the nice thing about the Dictate tool in Microsoft Office applications is it's available in a lot of the different apps like Word, PowerPoint, Outlook, and even OneNote. Let's take a look. All right, let's start in Microsoft Word. All we have to do is come up on the Home tab. Over here in the Voice area, you'll see the Dictate button. Just click on the drop-down and select Dictate. Now, when I click on this, it will automatically start listening. And if I'm not ready, I just want to click on that microphone icon to turn it off. So I'm going to click it, and I'm going to turn it off to pause it for just a minute. What I wanted to show you first is if you go into the Settings area here, you'll see that it will start with your spoken language. It'll pick up English, so you can select that there. This first option down here is Enable Auto Punctuate. You're going to want to make sure to turn that on. And that means that if you speak in a sentence-like structure, that the punctuation will automatically get placed in there for you. So if you type a question, it'll have a question mark at the end and things like that. So you want to turn that on so that it will auto punctuate. And then the other item down here is the filter sensitive phrases, and that's automatically turned on by default. And all that is if you accidentally say a swear word while you're talking, instead of typing that word, it will type asterisks instead. So those are some of your settings that you can turn on and enable. So I'm going to click Save. And then when you are ready, all you have to do is click on the microphone icon. You'll hear a little tone, and that means that it's listening. And then all you have to do is speak, and it will start typing for you. So let's give it a try. Here's my HR task to-do list for July 15th. How many items do you think I'll be able to finish? Here's the list, : Start bulleted list. Conduct performance reviews for my team. New line. Screen candidates for open positions. Next line. Update the employee handbook. New line. Coordinate training sessions for new hires. Undo. Undo. And I'm going to click the microphone icon to stop. So notice at the end there when I said undo, it did delete the last phrase that I put in there. So you can use different voice commands for different things. And so what you'll want to do before you get started using the tool is come up to the help icon. And this will open up a help window over here on the right-hand side. And you can scroll down and go through all of the different voice commands that you can use. So anytime you want to put a period or full stop, things like that, you can just scroll through these different types of options here and see the different phrases that you can use to assist you with your voice typing. Now, the nice thing about Microsoft is that this Dictate tool is available in several of the other applications. So for example, if we are in Microsoft Outlook and we want to create an email, we can put our cursor down here in the body of the email. And same thing, we can come up to our Dictate tool, turn it on, and it will start listening for us. The pop-up window comes down here, and it will just start typing as it hears you speak. We can hit to pause that, and you also have your settings and help options down here. Also in PowerPoint, if you come over to PowerPoint, the one thing you will see it in PowerPoint on the Home tab, you'll also see the Dictate option, but you do have to have a text box. So for example, we want to come in, we want to make sure we have our cursor placed in a text box before we go back to our Home tab and start to dictate. So then you would just click on Dictate and start talking from there, and it will type everything out in your text box. Now, if you don't use Microsoft Office and you still want to use voice typing, you can use this in Google Docs. So if we come over to Google Docs, all you have to do is go to docs.google.com and sign into your account and then open up a new document. And from here, just come up to Tools, and then you're going to click on the voice typing option here. And that is going to bring this pop-up menu here. And if you hover over it, you'll see the little help icon. So if you click on that, it'll open up the different voice commands that you can use here in Google Docs. So you can get familiar with that. Now, one thing I will say is that I noticed that in Microsoft Word, the auto punctuation worked really well, whereas in the Google voice typing, you do have to use a combination of keyboard and speaking so that you can easily and quickly make new bulleted lists and items and hit enter. And I did have to use commands for my punctuation like question marks and colons. So, but you can definitely try it out. All you have to do is click the button here to speak, and it will listen and start typing everything that you say, period. And then just click on it to stop. So that's how you're able to use voice typing either in Google Docs or in Microsoft Office. I hope you have fun with voice typing now that you know how to use the tools. If you found this video helpful, be sure and give it a thumbs up to like it. You can subscribe.
So you've seen how you can easily get those things within the Word document or within the Google documents and be able to use them because they are here for you, and they help to support all that within that section. So especially when you are using Office 365, you'll always see them within this other area here, 365. Or you can be able to use that Google Documents. Still, you can easily be able to get them there. So we have also those ones like the translators and so on. You can be able to have them here, translate, select the text and what so on. So even the translators are also available within the space or the tools that we have. So you can link with several tools, other tools, to be able to ensure that you get all these things done. So all the advanced Microsoft tools nowadays have all those incorporated into them. So you can easily be able to find them and then be able to use them within your space. So and those are the things that people are not aware that they exist, but they are just there within your own, within the tools that you normally interact with. I know some of them comes as a shocker, but it is always there for you to be able to know where these tools are. Then we have the multiple means of engagements. For you to have the multiple means of engagements, then we have the gamified AI learning adapters or adapts that rewards the system to motivational type. Then we have the AI detect that disengagements via response patterns and re-engagements. Then we have what are called personalized AI learning schedules for matching the learner energy speaks. When the energy when the spoken languages are being done, or the energy peaks, and how all these several elements can be done. Now we have the social AI group tools for collaboratives and the solo learners. So all these are very, very powerful tools that we categorize them as universal design for learning. Then we have the complete tools directories, that is inclusive learning. How do we achieve the inclusive learning with that? Then we have the Microsoft Seeing AI that can support the visual assistance, and it can be used for describing objects, text, and people aloud via font. cameras for blind and low vision users. We also have the NVDAs or the JAWS that have the screen readers for reading the screen contents aloud, especially for those ones who have the visual impairment issues. Um, we have the Google Live Transcribe, which is used for captioning and getting all the real-time AI speech to text captions, especially to help the deaf and those with the hard of hearing learners issues. Then we have the Otter AI. This one normally, or the Read AI. These ones are normally used in transcription of texts and content and perform the meeting summaries, especially like if we are in a meeting like this, and also converting them into texts that can be exported so easily into a document or minutes. Then you have AI transcribes lecturers live with speaker labels. We also have the review notes after classes. This can be done with that. Then we have the read and write, the text help types, which are normally used to in text to speech. They are also used for word predictions, and they are also used for highlighting for dyslexic types of learners. Then we have Proloquio to Go AI tool, which is used for augmentative communication. Then we have AI assisted pictures to speech and nonverbal learners with the autism issues or autism cases. Then we have the immersive reader that is developed by Microsoft. They are normally used for supporting reading, that is adjustable text spacing, syllabus breakdown, and reading aloud. They build into word edges. You also have the AI tool called Be My AI or Be My Eyes. That is the one that supports the visual descriptions. That is it is found within the Chat GPT, but a model called GPT-4, where that it can be able to describe any photo in details for the blind users instantly. And that is what can also sometimes is used to even generate some of the images and so on. All this is GPT-4 uh, tools. So for you to practice this, I have some tasks here that you can be able to do it within 12 minutes. That is the goal that I want you to do is to walk in a learner's shoes, experience how assistive AI removes the barriers. So number one, choosing your scenarios. For instance, you are supposed to pick one, that is close your eyes and then use the seeing eye. Or maybe you can close one of the eyes and then use one. Mute the sound, like by blocking your ears, and then use live transcribe to be able to get the transcription of the voice of someone who is speaking to you or any gadget that is around you. Then you can use immersive reader on the dense paragraph. Then number two, you are supposed to install and activate some of the tools here. That is, download the free app Seeing AI or Live Transcribe or Open Immersive Reader in Microsoft Edge. So you can easily search for Seeing AI, which is a tool that is widely available. That is, you can just be able just to go online there and then search for Seeing AI app. So you can download for Android. It is here Seeing AI, or you can decide to use it online. Let's see, so that you can be able to see how it works. So just see.
Seeing AI has been updated with a new user interface, and AI descriptions are now read aloud automatically. Let's explore it together. Hi everyone, welcome to Carry On Accessibility, where we talk about tech and accessibility. Seeing AI is such a powerful tool for people who are blind or visually impaired. It's on iOS and Android. It can read, it can describe things, and has a light sensor, currency, barcode scanner, and a lot more. I've discussed a lot of previous updates. You can check it out in this playlist. But today we're going to be exploring the new UI or user interface, and I think it is generally a lot nicer, a lot cleaner, even though, there's always something to be improved. Before I share my screen, I want to thank all the Koa members for making this video possible. If you want to support the channel and get exclusive perks like exclusive videos, monthly meetups, and early access to videos, consider becoming a Koa member on YouTube or Patreon.
This isn't just any chat, it's ClickUp chat. Sure, you can tag your team, ask questions.
So here is my Samsung S25 Ultra. We'll get to the iPhone probably near the end. It's very, very similar, but I'm trying to point it down so that it doesn't read anything right now. There are 3 tabs at the top of the screen. There's Read, Describe, and More. You can swipe through left and right to get to the different tabs when you're not using TalkBack.
Describe. Product.
And once you get to the More, instead of saying More, it immediately goes to all the other channels, and it shows you that at the bottom row of the screen. We have Product, Person, Currency, Color, Light.
Color, current, product, describe, read.
So most of those other channels are the same, except now for Read and Describe. So Read combines handwriting, the short text, and document mode. You can just move around. It's going to automatically announce any text that it sees. I have the Clubhouse magazine here. This is my son's.
To say the battle and to me is house processing.
This is document mode. I just tapped really on the viewfinder. You don't have to be super precise with where you tap, which I really like. And now I can press the play button on the bottom left.
You are the God who works wonders. Psalm 77 hours and 14 minutes. Light the house. Strengthen the battle. When I was 6 years old, it all attacked me.
So there you have it. It combines short text and document mode. I really like that. I think that's super helpful. Now we can move over to Describe. We can go ahead and take a picture.
One face near to processing.
Again, I just tapped in the viewfinder area. Not necessary to be precise on that little shutter button circle.
The image depicts a collection of children's drawings and crafts displayed on a wall in a desk. On the wall, there are several pieces of artwork. In the top left corner, a drawing labeled Anne Heather features a large, red, couch-like shape. To its right, a drawing titled Tita Carey shows a figure in a pink dress with a heart symbol. Below these, a colorful drawing with the words I love you in boom includes abstract shapes and a cross. Adjacent to this, a drawing with a rainbow-like arc and abstract shapes is visible. On the desk, there is a pink box with a pattern, containing various items including a pink game controller. A phone with a pink case is placed on the desk surface. A black phone charging station is positioned near the edge of the desk, with a coiled black phone cord extending from it. A pair of brown glasses rests on the desk, partially under the phone cord. A drawing with the words Happy Spring and a depiction of trees is leaning against the wall, partially obscured by the phone cord. Another drawing, featuring a landscape with trees in colorful shapes, is positioned at an angle, leaning against the wall.
Lots of descriptions. At the bottom left, we can ask more, and that text is a little bit cut off there, but that's okay.
The image depicts a collection of children's drawings and crafts.
I wish there was a pause button.
The game control.
It's kind of short. One thing that I don't like is as soon as you tap on Ask Seeing AI, it repeats itself, which I don't think is necessary. Or I wish there was a pause button so that we can control the speech, what it's telling us. But I really do like that it reads it aloud, because I'm not always using TalkBack. Or let's say my son, he is also visually impaired. When he uses Seeing AI, he doesn't like having to turn TalkBack on or having to read it. So I showed it to him and he was very efficient. Still navigate to these tabs. I can touch.
Selected. Read. Tab. 1 of 3. In list. 3 items. Describe. Tab. 2 of 3. More. Tab. 3 of 3.
So all of that works. However, if you do, it will violate those. So Android even more.
Voiceover on. Seeing AI. Menu. Button.
So that's the just
Seeing AI has been updated.
the simplicity of Seeing AI. Seeing AI is available for you to download both in Google Play Store. You just search for Seeing AI. For Android, if you're using Mac, you can easily get it. If you're using Microsoft, like this one, you can be able to download it. You can see it here. Then it can get installed to your computer, and then you can easily use it. So it can translate anything. You can see it here. So you can even attach it to your computer, and then support those who have the problems when they use your device. So you can download it from Google Play Store. You can visit Microsoft here at the Microsoft Edge and download it. You have it also in Google Play Store here. So it's easier to use that, to be able to. You can even just take a picture, and then because sometimes it can help the students to. You can try it at Edge, and then it can be able to work within that everyday AI, that possibility. So because sometimes these people cannot be able maybe to see, they are blind, but they want to know what is ahead, what is in front. So they can just easily tap the screen, and then it does the screen capture. Then once it does, it can be able to describe the entire environment, so that the blind can be able to know where they are headed to avoid issues like the accidents and any other related matters that might endanger these people or these children, especially when you are in school or whatever. So Seeing AI is a very powerful tool for that. Then you can complete the task by identifying 3 objects in the room, or transcribe 1 minute spoken passage, or have a paragraph read aloud to you. As demonstrated on that video, you can easily also be able to practice with that, so that you can easily get to master how Seeing AI tool works. Then reflect and share. So you can discuss what surprised you. Where did the AI struggle? How would this change the learner's school day? And so on. Especially if you are in special need areas. I think that will be much better for you to capture and grasp such a knowledge. Now let's look at AI in healthcare. That is in terms of diagnostics, patient care, clinical decision support, and medical education. So AI is widely consumed right now in the medical space, uh, including even doctors use them to make final findings. So the medical imaging and diagnostics. Sometimes you find that you are suffering from a certain disease, but you know very well what are the conditions or the symptoms that you have. But then maybe booking a doctor is maybe expensive. So what do you do? So normally nowadays people can use AI tools or chatbots to be able to know, or to get some basic description of what is ailing them. And some of the people just use them and they kickstart the medication. And it beats the logic of going to the hospital and so on. But it is good that even if you have got the information from that, you can easily now use the information to confirm whether it is true or false from now the medical doctor, so that you can have 100% accuracy, because they can do up to 95% but not 100%. So the 5% is left for verification and authentication. So medical imaging and diagnostics, we have AI detectors for biometric retino, retino, retinopathy in the eye scans with 90% accuracy, where they use what is called the AI tool called the Google DeepMind. Then we have radiography AI reads the chest x-rays for TB, pneumonia, and COVID-19. So these tools are very critical in terms of the resource limitations settings within, like in Kenya. Then we have also some of them that are used for detecting breast cancer, like the MIT study area had looked at a few that are being used to detect the breast cancer. Then we have the clinical decision support. That is the AI systems like the Isabella DDX, which is used to analyze the symptoms, and they can be able to suggest differential diagnosis, or the EPICS AI flags sepsis risks up for 6 hours before clinical deteriorations and enabling early intervention. So these ones are also very important because up to 45% reduction in diagnostic areas have been using the Isabel DDX to sort out some of the problems. Then we have the drug discovery and genomics. We have the AlphaFold Google DeepMind predicted and structure of up to 200 million plus proteins, revolutionizing some drug areas and handling so many other matters. So AI has come to accelerate the vaccine research as seen in the COVID-19, mRNA development, and all other medical discovery innovations. Then we have the patients monitoring and predictive care, like you can monitor your temperatures, your blood pressure, your your stress levels, and so on. Wearable AIs like the Apple Watch, the Oraimo watches. We talk about Google watches, with things or white things. Then we have, they can be able to detect rhythmias and falls and oxygen dips. They can also be able to be used to test the oxygen level and the blood level within the body, and they are able to execute such. So they have supported so many areas, up to they have reduced around 30% in the ICU readmissions with AI monitoring. So you find that most of these tools and systems being used within the ICU now, all of them run also by the help of the AI. So we have the AI in medical education and patient engagements. So where are these being used and which ones are they? So these tools are very powerful. Let's look at the AI in medical education and patients engagement. So AI for medical education, we have the visual patient simulations, whereby we have AI patient presents symptoms for students to diagnose. We have the risk learning and environment and shadow health. We have AI anatomy tutors. We also have personalized medical study, that is AI platforms like the Ambos. Ambos, you can also be able to search for another one called Ankai AI. These ones, they adapt spaced repetitions to each student's weak areas. So you can be able to look at them, Ambos, and how it works. So you can easily search for such tools and both AI. So it is sorry, Ambos AI. Ambos AI tools. So they are here. They also support some tutoring and so on. So it's here. A very powerful model developed at Stanford, Harvard University. And even currently, it is still under development since the start of the COVID-19. That's when most of the medical scientists assembled at Harvard and Stanford University to develop this clinical care safety called Ambos AI Mod. So this is the one that you can see it is still there. But then you can see here 24-year-old worm and so on. So you can easily speak to it and it can easily do for you some 1, 2, 3. So it's still under testing, still under development, but you can still use it a little bit for diagnosis. So these ones are called the smart doctors. In the future, we shall be able to have it. Currently, we are also launching our Afia Dollar Edge. This one also is, we have an AI self-doctor inside here. You can see the tools that we are talking about here. You have the telemedicine, you have the AI radiologist, you have health logistics and cloud analytics and so on. So within the system, you have a section where you can just speak to the tool, and then it is able, like we have the AI screening here for automated risk assessment. So once you just communicate to it, it can easily tell you what you are suffering from or what is needed. So it's just that currently we have, so we are still building it, and just like by the end of this year, we shall be launching this, the Dollar Afia, because we also have radiology support. We have drone support for health sectors to facilitate that, emergency special care without traveling delays. You have emergency ambulancing and so on for supply of medical support issues. So I'm still building it, and once it is done, then it will be deployed to the government and other sectors, just the way we have done with another product here called the Dollar Shamba. So this one already has been incorporated by the government, and it's now consumable and used by the government to execute several things to help farmers. So soon we shall be launching this, the Dollar Afia, in order to sort out also some of the issues in difficult areas. So as the company, we are building a lot of smart AI and machine learning tools to be able to support and help solve problems. So we have the Ankai AI also, which is also used in the Ankai AI. So there's here the Anki AI. So just to know just how Ankai AI works, you can just watch this a little.
So I owe pretty much all the success that I had in life down to the fact that I used Anki. And I'm not kidding when I say that Anki is the reason that I got into Cambridge University. But basically, about 3-4 years ago, when I was making Anki related videos on YouTube, we had to make Anki flashcards by hand. So we would have to read a book, or we would have to watch a video, take screenshots, and then make those flashcards. But nowadays, a lot of that process can be automated by AI, which means that you can focus more on understanding the material instead of just typing notes. And I'm going to go over that in this video. But basically, you might be asking, why would you use Anki over some other programs that have AI built in? And the reason is that Anki is free, and it also has a lot of community support. So you can download Anki. I have a previous video about how to download and use it. And if you go to add-ons, the add-ons page, then you can see literally hundreds of add-ons made by the community for pretty much anything you can imagine. So there's like a pop-up Wikipedia add-on, there's a field autocomplete, there's a Chinese add-on, text-to-speech add-ons, and you can go on YouTube and you can search Anki add-ons, and then you can find add-ons for say language learning, medical school, and pretty much anything else that you can imagine learning. Now, the way to actually start out with this is you want something that you want to learn. So for example, this video on transformers and how LLMs work, and you want to go to Google AI Studio, and you also want to copy this prompt that I have in the description. So this prompt is on a community that I have, and you can just go to the page and then copy over this prompt. So this prompt specifically is for Google Gemini, and there's another prompt for ChatGPT which you want to pay attention to. So copy the Google Gemini prompt and paste it into Google's AI Studio. And you can see it takes up this many tokens, 435 tokens. And we want to copy the URL for the video and then also paste it right at the bottom underneath message. And now you can see it's loading the tokens, and it loaded another 473,000 tokens for this 27-minute long video. And the reason you want to be doing Google AI Studio is because Google own YouTube and they can download the video, and this Google Gemini can actually watch the video. ChatGPT is
So
postcards, and over time I will be adding more types of prompts here for different types of cards. But anyway, we have this.
Much consumed also to support within that area. So it's something that you can take some time to go through it and then get to understand better. But it's so easy to use it. In various areas, it's free. But then now, if you want now to do now large tasks, you can now be able to make a payment for the large models. Then you have the surgical training AI, like the robot assisted. We have some studies that have been shown that we have some of the robots that are performing surgical or surgeries, and they have done successful. And these are also things that we really need to look at. Why? Because out of the experience, the doctors and how they have been doing, they have been able to create what are called models that are able to control and manage the robotic tools to be able to conduct the same. So you get into a theater, and then you are interacting with a robot. You think that it's a human being. So it's explaining to you, it's asking you questions, it's preparing you mentally, and then you find yourself that now you are in the bed, now trying now to prepare yourself for the surgery, and then it comes there well prepared. Instead of having so many nurses around, then it can be able to do, because once it knows that all the things that are needed have been assembled to it, it's able to conduct that surgery completely within a short period of time, just like the real doctor, a human who is there. So robot assisted surgery simulators with AI feedback on precision, speed, and also technique. Then you have AIs for patient care engagement. That is the AI health chatbots. You have the Ada Health, the Babylon or the Babylon, the patient self triage before seeing the doctor. So you have the Ada, even our dollar Afia or Afia dot dollars age. You have the AI assistant, whereby you can communicate to it, and then it is able to analyze all your symptoms and issues, and then it is able to give you the proper prescriptions or diagnostic uh, suggestions. And within the same system, you can easily book the doctor that you feel like you need one. So we have the mental health AI, that is the Warbot. We also have the Warbot. We have the Wiser, which provides the competence-based, technical-based support for anxiety and depressions, or the CBT-based, bridging the Kenya's mental health gaps. Then you have the medication adherence AI, which is it gives the reminders to bots, the reminder bots that is used to help the patients to remember whether they have some medical attention to get, the dosage, the smart pill dispensers, and AI to follow up calls, improve chronic diseases management, and so on. We also have the AI language translations, which is real time AI interpretation bridges for doctors and patient language gaps, especially in the multilingual communities. Like maybe you've gone to work in Kisi or any other parts of the country and you don't understand the language that those people are speaking, you just use the tool and it's able to translate for you. We have tools like Siri. You see, when somebody is maybe in France and is not able to communicate in French, then the Siri is going to be your father and everything, your guider and everything, because it can get for you the location, it can translate for you the language that's being spoken around you, it can be able to translate the train calls and the management and discussions that they are opting for the travelers and so on. So, what are the complete tools directories for healthcare? We have talked about Ada Health, we've talked Isabel DDX, we've talked about Dollar Afia, we've talked about Google DeepMind, then we have the Babylon Health, then we have the Wobot, the WISA, the Epic Sepsis Model, the AlphaFold DeepMind, and then we have the Nuance DAX and Whisper. So these are very, very powerful tools that are able to support within the health section. For instance, if we maybe check like the Babylon Health or the Warbot, let's say we are looking for chatbot for anxiety, depression, and stress support. Let's look at the WISA or the Warbot. How does it operate? Let's come here to WISA. Or the Warbot or WISA. How it operate. So this is the Warbot. So you can easily download it to your computer. Let's just see how it works. Let me just the Warbot Health. Or the Ada Health. You also have what's called the WISA. The WISA. WISA. Single. The WISA. Still need to restore this. Why? So let's just see like the WISA. So this one is normally used to manage the daily issues about stigma, stress, and all those related issues. So, for instance, if there are people who have a lot of mental challenges or disorders within the environment or the working environment, then the WISA is the tool that can be used to help such, because sometimes you can have just interaction with the tool, being asked some questions here and there, and then you are interacting with it for you to get the solution. So you can easily just find them during your free time for that case. Um, they are very, very powerful tools that we are using today. So it's important that you can easily look at them. We have the Babylon, we have the AlphaFold, and all of that, for you to be able to interact with them and see. So I think I'll not handle the AI in legal systems. That one I'll leave it for next session. So here I want you to try several of these AI symptom triage exercise. Number one, that the major thing here that I want you to use is the tool like the Other Health app or the Chat GPT. And what I want you to test yourself is to compare the AI symptoms triage against the clinical judgments and the spot its limits. Have maybe a suggestion that the doctor had given you on a certain disease that you are suffering from the hospital, and then try to use either the Chat GPT or the other app, health app, to be able to see if you are getting almost the same results. Build a case as a group, write a realistic patient scenario. So here I want you just to do it as an individual. Just write a patient case or a group for a patient scenario case. Put the age, the symptoms, the duration, and the history, and then keep it simple for that case. For instance, if we speak about the Dollar Afia tool, remember when you log in here, for instance, let's say you log in inside the tool, and then you want to do like a diagnostic by yourself. So the tool is very, very uh, powerful here. For instance, that you want to test like an X-ray for medical screening. Maybe you had an ultrasound that you took or the CT scanner. You can just upload here the image and then it's able to analyze that and provide you with the solutions. For example, that now here you want to do AI self-diagnostics. You can just start here with self-diagnosis. So you can tell yourself what is the general issues about your body. Let's say maybe you have the fever, you have the loss of appetite, and maybe you have some joint pains. Then on the respiratory, maybe you have wheezing or you have the shortness of breath, and maybe on the gastration areas here, maybe you have constipation, and then the bloating and gas, and maybe on the neuro surgical and brain issues, maybe you have the muscle weaknesses, and then you have the dizziness or the vertigo issues. So maybe on the mental health, maybe you have more anxiety with yourself. And then on the skin, maybe you have some skin rash and irritations. And then also down here, maybe you have issues with cardiovascular, maybe you have slow heart rates, and maybe you have contact with the mosquito, maybe recent travel to malaria or unprotected, let's say contaminated water or animal bite, scratch, like that. And maybe those are the things that you had. So you have already selected around 13 symptoms, and maybe you want to do a test, a medical test by yourself, because maybe these are the real symptoms that you really have. And so that is how the system is able to analyze that and then be able to tell you that you have rabies. That is the post exposure to clinical suspicions. Urgently, it has recommended you that the combination of an animal bite, neurological symptoms, anxiety, weakness, dizziness, and respiratory distress, shortness of breath, constitutes a medical emergency that requires immediate stabilization and evaluation for the rabies PEP or treatment. So already, because you have said that you had a contact with some animal bite, that means that rabies PEP can be the one that is affecting you. So differential diagnosis, you can do what is called the systematic viral infection or arbovirus like chikungunya or dengue, or maybe there is a possibility for the sepsis secondary to infected wound or the severe malaria with complications. So, what are the tests and recommended solutions? That rabies, flow ensured, we have antibody test if applicable, full blood count, you can be able to do that, blood culture, chest x-rays, you can do those ones. Recommendation, proceed immediately to the nearest emergency department or level 4 to level 5 hospital, not less than that, so that you can be able to go to a hospital that can handle this. Do not delay seeking care for at-home remedies. And also it tells you that you should be able to have alert medical staff immediately about the animal bites history. So what are the red flags? Seeking immediate care if you have to do the hydrophobia, fear of water, confusion for hallucinations, then difficulty swallowing, seizure, and inability to breathe. So those are the issues that the doctor needs to take immediate action. And from here, it can easily link you to the hospitals and the emergency that can easily take you through so that you don't delay so much. It has suggested for you St. John's ambulance with the call number that you are supposed to call so that you can get that immediately, or you can as well as get direct into contact with this specialist, that is the critical care specialist. So if you want to get that, it has given you here, you can just click there, or find a neurological or neurologist directly. So how do you find this? All these people are within the system because we have the specialized doctors here. So the symptoms are here. So if you want to get a critical care specialist, just click there, and here it is. So within the system, it has brought you to the specialists where you can be able even just to search for even within your locality. So you can pick, maybe it's a neurosurgeonist that you are looking for, neurologist or cardiotherapist or whatever. So you can search for that specialist that you want within this area. So they accept booking, and you can easily do the booking within. So either you want to follow up or check up telemedical conference, so that you can easily search for them and communicate immediately. So all these are specialists, and all this are within the system. So I talked to you about also those ones that can support the audio. So you can just click and then you can start just speaking that I have some headache and I also feel some severe, or I have some running noses, I have some cold legs, and sometimes I'm not able to eat well. I have loss of appetite. So once you do that, then it's done. So it has finished. So it's here, it has converted all the text that you had. So after speaking, then you stop it and it will translate the entire, all the text that you said, and then it's able to convert it so that now it can tell you here what is there. So it analyzes it instantly from the speech that you spoke and what you explained. So it will act like a doctor, the way you are explaining to the doctor, and then it's able to listen to you and then be able to analyze and do everything about you. So viral upper respiratory infection, common cold flu, because I said I have some running nose, loss of appetite, severe headache. So you see, it took all those symptoms and it's able to give you, and it's telling you the confidence is 85% to be cold flu and something. Then you have the sinusitis or COVID-19 based on certain areas. So if you want to get the doctor here, so you can just go to find the doctor, and then you get to the doctor said here, and then you can book the doctor that you want instantly. So mostly even down there, it has suggested for you which type of a doctor should you be able to get. And you can easily even book appointments to such doctors. So you can pick any doctor who is available within the system and then be able to contact and then have a session with them. So that is what the dollar Afia has, and it's very huge. in terms of the services that it has, and it's a system that I'm soon launching. I'm launching it on behalf of the company. So we want it to go because we are offering both the health services and the agricultural services, in addition to the education sector. That's why we do the training as we also build all this to be able to sort out issues. So that is some of the things that we talk about the AI support. So you can compare to clinical reasoning, have a clinician in the group give their own assessments, then compare to the AI output, then identify the gaps. What context did the AI miss? Could it be having? So this one you can test it at home, so that in the next session we can be able to look at AI in the legal system. So I wish to end my session there for today, so that you can go and interact with these notes, and then interact with all the tools that we have suggested inside here for AI in healthcare, and AI for inclusivity, learning, and special needs, so that we can be able to have a better and clear way of understanding those concepts. I will wish to end there unless there is somebody with a question. If not, then we can meet tomorrow so that we can complete with that area of AI in the legal systems before we now start another last module that is still pending. So thank you so much, and have a blessed night on your end.
Same to you, Prof. Thank you too.
Goodbye.